I'm Dr. Khatija Khan, and this is a brief introduction to neuropsychological assessment. Neuropsychology is a branch of psychology that focuses on how the brain and the nervous system affect a person's cognition and behavior. It is a specialized field within clinical psychology. Clinical neuropsychologists often work with patients who are affected by injuries or illnesses of the brain, and one of their roles is to perform neuropsychological assessments. So what exactly is it? A neuropsychological assessment is a performance-based method to assess cognitive functioning. It is used to examine the cognitive consequences of brain damage, brain disease, and severe mental illness. In this presentation, we will cover the purpose and goals of neuropsychological assessment, and we'll also discuss how it is done. So what is the purpose of a neuropsychological assessment? There are two main purposes, and the first places more of an emphasis on diagnostic value. This is especially so for circumstances where the medical diagnosis is more obscure and cannot be verified precisely by medical imaging techniques or laboratory investigations. Examples of conditions like these include learning disabilities, attention deficit disorders, dementia, for example, Alzheimer's disease, as you could see depicted in the image on the left, and also minor head injuries. In conditions like these, neuropsychological assessment can be quite critical in confirming a diagnosis and increasing diagnostic accuracy. In other conditions, the medical diagnosis is quite clear, and as such, the purpose of the neuropsychological assessment places less emphasis on diagnostic value. So, for example, stroke, epilepsy, multiple sclerosis, or AIDS. In these conditions, the medical diagnosis is clear, and as such, the neuropsychological assessment is used for other purposes, like documenting the patient's cognitive strengths and weaknesses, discussing their real-life functioning, and this information is used to identify effective treatment strategies, as well as identify appropriate placements for school or vocational settings. So the goal of neuropsychological assessment then is to depict the current and future adaptive capabilities of the individual. The assessment helps us to identify, to quantify, and describe changes in behavior that relate to the cognitive integrity of the brain. Serial assessments, or repeating the assessment at different time points, can establish a baseline that we can then use to compare to demonstrate gradual improvement or deterioration in mental status over time. So the assessment gives us information about the impact of the patient's challenges in different areas of functioning, and these results can then be used to inform decisions about recommendations for rehabilitation and treatment, and what the patient is realistically capable of doing, be it at school, socially, or at work. So how is a neuropsychological assessment done? There are different components. Clinical interviews are conducted with the patient and sometimes an informant like a family member. Other sources of information like medical test results and brain scans are also considered. Then paper-based or computerized testing in which a battery of different tests are administered. On average, an assessment can last from 2 to 6 hours, and this might depend on the patient's level of functioning or on the condition being assessed. The testing is split over multiple sessions to avoid the patient getting too tired, and frequent breaks are also offered as needed during the testing. During testing, a number of different cognitive domains are assessed, and these include orientation, attention and concentration, language, memory, motor skills, processing speed, visuospatial skills, and executive functioning and abstract reasoning. For example, patients might be asked to copy the figure on the top left, and this is used to assess visuospatial skills and can also be used to assess memory and executive functioning. In the example on the bottom left, we see an example of a patient with schizophrenia who has attempted this drawing. Let's look at another example. So the semantic or category fluency test can be used to assess one component of language functioning. So patients are asked to name as many exemplars as they can from a certain category in 1 minute. So for example, if the category is animals, someone might respond, so a neurotypical person would be able to list examples throughout the entire minute, whereas someone with challenges might struggle to come up with items and the rate of production of exemplars may decrease with time. Let's look at a couple other examples. In this test, we are assessing executive functioning, which involves planning and problem-solving skills. In this puzzle from the Tower of London test, you need to move the balls one at a time from the position at the top to the position at the bottom. You try it. Press pause while you attempt it as the answer comes up next. And there you go. Solving this puzzle requires a minimum of 7 moves. In this example, we are assessing semantic fluency using the pyramid and palm trees test. So the patient needs to select from the bottom row the picture, either the eye or the ear, that goes best with the one at the top, the glasses. Which would you pick? In this case, you'd need to pick the eye. The eye goes best with the glasses. In this test, we are assessing attention and processing speed with the Stroop test. So have a look at the diagram on the right. You need to ignore what the word says and say the color ink it is printed on. For example, for the first word, the correct response is blue. You try it. Press pause and start with the first column and then go on to the next as fast as you can till you're finished. So there you have it. A brief introduction to neuropsychological assessment, a performance-based method that is used to assess cognitive functioning. It can be used to improve diagnostic accuracy when medical diagnosis is unclear, and it can be used to describe a patient's cognitive strengths and weaknesses, as well as their current and future functioning. This information can then be used to inform treatment and rehabilitation and to make decisions about what is best for a patient at school, socially, or at work. The assessment is carried out using clinical interviews, corroborating sources of information, and pen and paper and computerized tests that assess a range of cognitive domains. For more information, click on the relevant links in the description below to find out more on details of what to expect in a neuropsychological evaluation, clinical applications of neuropsychological assessment, and textbooks on clinical neuropsychology and neuropsychological assessment. Thank you for listening.